Now we'll talk about tumor markers. So tumor markers are certain glycoproteins or proteins or enzymes which are elevated in certain malignancies. Not every tumor will have a tumor marker, but there are some tumors which will be having their respective tumor markers. Before going to the topic proper of looking at the individual tumor markers, let's briefly look into the significance of the tumor markers. So generally, these tumor markers cannot be diagnostic or gold standard in the diagnosis just because these can be seen in less than 3% of the normal subjects, and some cases of inflammatory and benign lesions also, these proteins or substances can be elevated. Then what is the significance? Why we are supposed to remember or read these things? The significance is these are used for the prognostic things and the follow-up things. Prognostic means if the best example is carcinoma prostate, for which the tumor marker is PSA, prostate specific antigen. There are two cases of prostatic specific, there are two cases of CA prostate with elevated prostate specific antigen. In one case it is increased 1,000 times, in the other case it is increased 100 times. The significance is, so the tumor burden may be more in a person where the PSA is elevated 1,000 times than the person in which it is elevated 100 times. And the second one is for post-operative follow-up. Both the cases whom we have seen much earlier, they were operated for prostatic carcinoma. So you expect the PSA levels to fall shortly after surgery. But even if the post-surgical things, even if the PSA is elevated, then it means that there is some tumor metastasis or some tumor residue left in the body itself. So these are the significance, and very few tumor markers will be remembering now. One is, which we already seen, is carcinoma prostate, which are prostatic specific antigen, prostatic acid phosphatase. Medullary carcinoma thyroid, you have calcitonin. Alpha fetoprotein, which is seen elevated in hepatocellular carcinoma. The same alpha fetoprotein can also be elevated in a gonadal tumor like a yolk sac tumor, which can be seen in the ovary or the testis. So these are few examples of the tumor markers.